Welcome. Axxess would like to thank you for joining us today for this high-level overview on using technology to streamline daily operations for home health administrators. My name is Jeni Kendall, and I have served as the administrator and executive director of a major home health organization, supervising multiple locations from startups to large branches. I have been in your chair and understand the day-to-day needs of clients like you. I have worked with and consulted with administrators on using Axxess's scalable solutions to solve staffing challenges, drive revenue growth, and improve patient care. Today, I will highlight some of the operational, financial, and clinical management features designed to support you in driving excellence within your organization. The controlled flexibility we provide to our clients is why Axxess Home Health is used by more Medicare certified agencies than any other solution on the market. During this demonstration, I'll share how easy it is to use the automated tools, dashboards, reports, and summaries in our solution to ensure compliance and grow your business in our ever-changing regulatory environment. Our unique culture and innovative approach is what we call the Axxess Way. Together with our vision and mission, these beliefs drive our organization on a daily basis. Our vision is to be the most successful global healthcare technology company, most admired for its people, partnerships, and solutions. At Axxess, we firmly believe the future of healthcare is in the home. And it is because of this fundamental belief that we believe our mission is to empower organizations and professionals such as you with the world's best technology solutions. Our value propositions remind me of my daily goals or job description as an administrator. In a few moments, we will review our flagship product, Axxess Home Health. What you'll see demonstrated is how our solutions can empower you to grow revenue, ensure compliance, and improve outcomes with our comprehensive built-in clinical intelligence. Most of us have had to learn to embrace technology. This makes ease of use even more important. Axxess is known throughout the industry for our easy-to-learn workflows that will help streamline your operations, not only for you, but for your field staff as well. Our cloud-based tools simplify implementation, decreasing costs. Axxess offers a diversified portfolio, including comprehensive electronic medical records for home health, hospice, and home care. With the first-to-market mobile solutions, clinicians and aides can document care bedside while ensuring compliance with electronic visit verification. We are certified to conduct home health and hospice CAP surveys for patient engagement. We offer revenue cycle solutions that help our clients get paid faster. Our RCM products and services ensure our clients' financial success by providing real-time automated claims processing and a direct connection to Medicare. Interoperability is key in helping our organization streamline your process and enhance our features. I will preview some of our partners in an upcoming slide. Robust analytic tools through Axxess BI can provide your organization visibility into performance and the data needed to make informed financial decisions. And our revolutionary scheduling and staffing solution we call Axxess Care connects home health organizations with available qualified clinicians in their area to fill those open visits. Now let's move on to our product demonstration. As you log into Axxess from our single source sign-on, you will see available over here on the left the many products and solutions that we just highlighted. At Axxess, we recognize that one of the biggest challenges you face is timely submission of paperwork from your field staff. And we have solved for that challenge by highlighting here on their Axxess Planner everything that they're responsible to turn in for the day. First, you're going to have a listing of all of the visits that they have been assigned to complete on a daily basis. With our integration with Google Maps, we're highlighting for them the geographic overview of those visits so that they can go to work efficiently. Down here is a listing of all of their past due visits, and from a single click, they can sign in, complete their documentation, and submit to the QA team. And finally, over here under alerts is going to be any visits that have been returned to them by QA with a note of the documentation that is needed. As you log into the solution, you're going to be greeted at My Dashboard. This dashboard is based upon the roles and permissions that you have assigned to each one of your employees. We are going to highlight for you updates and features within Axxess that we've recently released, along with bringing you updated industry and regulatory updates. Our recertifications tile is going to assist you in staying on top of your revenue by giving you drill down capabilities into your upcoming and past due recerts. Below that, with a single click, you can directly go to our billing center or observe and investigate your outstanding claims. And finally, if you're assigned any patient visits, they're going to be over here under My Scheduled Tasks. Now let's look at the PDGM Center. From the PDGM Center, you'll be able to easily access our online PDGM Resource Center, along with utilize our proprietary PDGM modeling tool, which will assist you in establishing revenue prior to intake. Now, we certainly recognize the many challenges that we faced in 2020 with managing our LUPAs and have highlighted that for you here under our LUPA risk alert. Whether it's a LUPA because of the recent PDGM changes or maybe from the impact of COVID-19, you'll have the ability to easily drill down and investigate to ensure you do everything possible to protect your revenue. Over here to the right, we're summarizing for you your average length of stay, and we're looking at this information across the entire agency census. Over here, now we have our patients that are due for an upcoming 30-day review and possibly a change in focus, along with continuing to monitor our upcoming recerts. We want to ensure that you stay below the 10% outlier cap, and that is highlighted here. And once you have loaded your expected cost into company setup for your visits, you can look at your actual and expected gross margin percentages. Next, you can see that we are looking at your average expected payments for both your first 30-day and your second 30-day periods, and we're breaking that information out for you by the clinical grouper based upon the primary diagnosis that was included on the OASIS. You're able to drill down for all of our dashboards and obtain more specific patient information. Next, we're going to look at the admission source and timing at both start of care and admission. It's going to be important for you to know where your referrals are coming from, whether they're institutional or community, and of course that will be impacted as well by whether they are early and late in their timing. Functional status is very important for you to monitor, as it is the only part of the OASIS that you're able to control at the agency and will have a significant impact on your reimbursement. From here, you're able to drill down and look at your clients based upon their low, medium, or high functional status at both start of care and recert. And lastly, we're providing you information based upon the comorbidity adjustments that again is going to impact your payment both at start of care and recertification. Lastly, we're going to be looking at our average estimated margin for each of your billing periods for both the first 30 days and the second 30 days. We recognize that the impact of the visits have and have put those together in order for you to be able to compare outcomes and cost with your visit utilization. Next, we're going to look at the patient-specific PDGM dashboard, which is available here at the PDGM Patient Center list or from the client chart as well. This is designed to give your clinical leadership the data needed to better manage each patient's episode, tying together clinical outcomes with financial analysis. Your leadership will be able to go directly into the client's plan of care or plan of care summary, along with providing them clinical and visit alerts. As you can see here, this patient recently had a hospitalization as well as had a missed visit. This may need to be rescheduled or an order written. We're again continuing to highlight for you the LUPA risk and give you the ability to go directly into the patient's 30-day calendar. Outcome potentials are listed here with drill down capabilities as well. Now, when we look at the HERG information here, your clinical leadership will be able to see the primary diagnosis, the clinical grouping, and their functional impairment. Here we're highlighting for you the expected payments and your LUPA threshold. And as you can see, projected here, because we have no visits scheduled for this client in the second 30 days, they are currently at 0 anticipated revenue, and we would be sure to want to address that. Over here to the right is going to be additional cost analysis information that not only includes supplies, but looks at your visit utilization so that you can determine how much of your reimbursement has been spent. And lastly, we're providing you a frequency and utilization summary by each of your primary disciplines. Next, we're going to move over to the Quality Assurance Center. Your QA team is able to adjust their workflow based upon the branch, date range, types of tasks, along with being able to adjust their workflow by patient, date, task, or clinician. As you see here, all of our Axxess Care patients will be highlighted by a turquoise heart within the QA center. As we come down and take a look, I wanted to highlight for you that within Axxess Home Health, we have included our Oasis Scrubber. This is powered by Home Health Gold and is available to both field staff out in the field as well as available here at the QA Center. Our gross margin calculator is my favorite tool within the software. It is an interactive tool designed to assist you with understanding the revenue and gross profit opportunity based upon the information entered by the clinician at the start of care. What's most important to remember is that this is done prior to locking in your Oasis and before the plan of care has been sent to the physician. The tool is going to take a look at all of the information that was entered upon intake, along with during the Oasis completion, and provide you a summary. Over here to the right, you're going to see where, under the case mix analysis, where your functional impairment scoring came from. You'll be able to move over here and see your expected payments, your total cost, and your expected gross margin dollars. Now, as you can see in this particular instance, the nurse completed and scheduled for all of the nursing visits to occur within the first 30 days. This had a severe impact on our reimbursement and turned the second 30 days into a zero payment episode. By simply adjusting the visits and spreading them out over each of the 30-day billing periods, we're able to have a significant impact on your gross profit. In this particular instance, it more than doubled. You are as well able to not only change the number of visits, but you're also able to interact and change the cost per visit as well. Next, let's move into the billing center. At Axxess, we firmly believe that revenue cycle begins at intake and ends with claims analysis. From the billing center, you will be able to select which branch you would like to work from, adjust your dates, look at claims by different statuses, by claim type, or by individual payer. As well, you will have the option to work over in pending claims and go to claims history. With the recent no pay wrap changes, we have added a calendar to assist you in tracking the age of your claims. Now with Axxess, we have not only automated the Medicare verification checks for you, but our claims tracking as well. As soon as each of your patients is admitted into the system, we will create that file so that you can ensure no revenue is lost. The system as well will continually update as each of the components are complete, and you'll be able to batch create your claims from right here within the system. And lastly, I'd like to take a look at our report center. While we have talked about many of the functional dashboards that we have within our solution, we also provide you more than 100 reports to support you in making administrative, financial, and clinical decisions within your agency. While I won't have time to demonstrate today, I did want to highlight that we take a mobile-first approach to developing our solutions, which empowers clinicians and caregivers to document at the point of care. Whether using an iOS or Android device, your clinicians can document a full Oasis assessment in the palm of their hands. Our mobile applications include unlimited electronic visit verification as well as offline capabilities. This ease to document will drive compliance, decrease submission time, and increase the accuracy of your care documentation. Axxess Care, our Uber-like staffing and scheduling solution, provides you an easy-to-navigate dashboard which allows you to monitor open visits and review qualified applicants for those visits. This ease of workflow will protect your revenue by assisting you in reducing missed visits. We were the first technology provider to be certified by CMS to provide CAP surveys and are proud to include in our suite of solutions. You are able to quickly and easily monitor your results from our single source login. The added value we provide includes benchmarking data to paint a better picture of the quality of healthcare services being delivered to your patients, and our automation simplifies the process because you do not have to submit a census report. Our team uses both phone and mail for surveys, and this mixed mode method will increase your patient response rate. Results and surveys are available real time, and we've also included a direct link and dashboard summary of your home health compare scores here. The market insights and competitor information will be very valuable to your sales and marketing team as they work to grow your revenue. Inclusive with our home health solution is Axxess DDE. Axxess is the only software solution with a direct connection to Medicare. This direct connection gives your billing team the ability to easily monitor cash flow, submit incorrect claims, or identify roadblocks directly from the solution. The agency billers have an easy-to-navigate workflow to ensure accurate claims processing. One of my favorite features is that this dashboard summary is emailed to you each morning, providing you the confidence of knowing that your agency's financial performance is meeting your expectation. Our all-payers product, Axxess RCM, provides you full interoperability with other non-Medicare payers. Utilizing our exclusive rules engine, Axxess RCM will streamline the billing workflow, reducing your claim errors. At Axxess, we give you full access to your data. Our business intelligence solution allows agencies to visualize their data in many ways to gain insight into performance, identify changes, and monitor key indicators, which will allow for more reliable business decisions to be made. You will be able to slice and dice your information by month or year and look at individual branches, set benchmarks, and navigate throughout the dashboard. As you can see over here, some of the information that is available in our PDGM KPI dashboard includes census, along with information related to where your referrals are coming from and whether or not they are early or late. I always monitored my conversion rate as an administrator, as I think it's very important. Then we include information for you on your patient to clinician ratio, along with giving you the ability to monitor your percentage of FTE productivity. Of course, in today's environment, managing your wraps and knowing how many days to bill wrap and days to bill final is very important. Over here to the right is some financial summary information, which will break out your revenue for you by each of your 12 clinical groupers, and at the same time give you information related to the agency's average revenue per episode. Utilizing Tableau, Axxess provides a diverse library of operational, financial, and clinical summaries like you see above. We can assist you in building custom reports to focus on the metrics of your choice. As you can see, interoperability is top of mind for us. In addition to having a feature-rich solution, we integrate with other systems to provide more value for our clients. From mileage tracking to claims automation, these integrations drive efficiency for our clients. Our partnerships give us the opportunity to react quickly to our client needs. Two of our most recent integrations include SureScripts, which will allow you to receive referrals and documentations directly from your referral sources, and Worldview, which streamlines the often cumbersome process of obtaining physician orders. With an intuitive and automated workflow, this integration will reduce the time spent waiting on physician signatures. Thank you for the opportunity to introduce our operational, financial, and clinical management tools within our innovative suite of solutions. If you would like to learn more about how Axxess can support you in driving excellence within your organization, please reach out to me directly or any member of our team. Thank you for your time today.
Axxess, empowering care anytime, anywhere.